Premier Doug Ford and Health Minister Christine Elliott are making an announcement right now. Let's go live and listen.
And Minister of Health Christine Elliott. Minister Elliott has stepped up to the plate. She is working around the clock to move this critical file forward. And it's the largest file in our province. And I have all the confidence in the world in the minister. During the campaign, I spoke to the people all across Ontario. At every stop, I heard the concerns about hallway healthcare. We have patients stuck in hospital hallways, waiting hours for emergency care and months to see a specialist. One patient treated in a hallway is one patient too many. No matter if it was Ottawa, down to Windsor, Thunder Bay to Toronto, I heard about the nightmare stories about the 4-hour waits, the 5-hour waits, the 6-hour waits. And I said over and over again, it's not the doctor's fault, it's not the nurse's fault or the frontline healthcare workers' fault, it's the system. The system is broken. I'm pleased to announce that our government is investing in 6,000 new long-term care beds across Ontario. These are 6,000 beds of 15,000 new long-term care beds we will build across Ontario over the next 5 years. This is the first 6,000 beds of the 30,000 beds that we will be building over the next 10 years. While we bring these new beds online, we know that Ontario families cannot afford to wait. So we're taking immediate action to reduce the pressure on our emergency rooms. We're making an immediate emergency investment of $90 million. That's 1,100 beds for the upcoming flu season. These new investments are going to make an immediate difference, but they're just the start. I've spoken to hundreds of doctors and nurses, and I can tell you the front lines are full of excellent and constructive ideas. It is time that politicians start listening to the experts, not the other way around. I've said over and over again, how can a bunch of politicians tell the healthcare frontline folks, be it the doctors, nurses, or frontline healthcare workers, how to do their job? No one knows better how to do their job than the doctors and nurses and frontline healthcare workers, and we're going to start listening. The previous government never listened. We're going to start listening. That's why I'm very pleased to be here today to introduce the Premier's Council on Improving Healthcare and Ending Hallway Medicine. Under the leadership of Minister Elliott, we have assembled the top healthcare professionals in Ontario. People who have spent their lives finding ways to improve the quality of care and the quality of life for countless people of our province. Chaired by our former CEO of Humber River Hospital, one of Ontario's leading healthcare experts, Dr. Ruben Devlin, the council will be tasked with creating a plan for the future healthcare in Ontario. And I have all the confidence in the world in Dr. Ruben Devlin. You saw what he did up on Humber River Hospital, the first digital hospital in North America. I always say that's a good footprint for other hospitals. And I'm here today to reaffirm their ambitious mandate, solving the province's hallway healthcare crisis and improving the system as a whole. Each member of the council comes with significant, and I say significant, experience in addressing the changing nature of healthcare in the 21st century. We have representation from across the healthcare sector, including those who have worked on the front lines. I want to thank each and every one of you for coming today and helping the people of Ontario fix the healthcare problem. With an aging population, time is of the essence. That is why I've asked Minister Elliott to focus on building a strong, vibrant, and sustainable healthcare sector that puts the needs of Ontario patients first. I'm confident that with the important work that you are doing here today, we can and we will get the job done. I'll hand it over to Minister Elliott. Thank you.
Thank you very much, Premier, and good afternoon, everyone. I would like to start by thanking Dr. Devlin and the members of the council for taking on this really, really important work. I have had the pleasure of working with many of you over the years, and it is truly an outstanding combination of people and talents and experience here today. And I look forward to working with you in the future and with Dr. Devlin as well. So I think everyone here, though, would agree that it is unacceptable to see our loved ones being treated in hallways and in storage rooms in our hospitals. It's no way to treat our loved ones, and it's no way for healthcare professionals to be able to deliver the excellent quality care that they want to deliver. So just yesterday, as the Premier indicated, our government took immediate steps to end hallway healthcare by committing $90 million to support over 1,100 beds and spaces across the province to help ease hospital gridlock in anticipation of the upcoming flu season. We also announced a new capital project at Humber River Hospital's Church Street site to create a reactivation care center that will free up hospital beds in the Greater Toronto Area for patients who need them the most. And finally, we have taken early action on our long-term care commitment to create 15,000 more spaces within the first 5 years by announcing the first 6,075 beds, which is an exciting announcement for us less than 100 days into our mandate. These are meaningful early actions we are taking to end hallway healthcare in this province, a promise that we made to Ontarians. As well, today's announcement of the people who will be serving on Dr. Devlin's council is an important step also towards keeping that promise. There is no doubt that we are faced with a very big challenge, and we are going to need real, innovative solutions in order to be able to reach that goal. But we also know that the people who plan and work on the front lines of our healthcare system know the problems better than most. They live it every day when they go to work. This council is going to help us put an end to hallway healthcare. Its members are among the best in Ontario in their fields. Their knowledge and experience will be key in helping us in what we need to prioritize and where we need to take action to improve our healthcare system for all Ontarians. I thank the Council for agreeing to work with our government to find these solutions, and I look forward to working with you. But I know the advice that they will provide to us will reflect both the needs of Ontarians and the perspectives of frontline healthcare professionals, and I look forward to receiving your recommendations in the future. Thank you so much for being here, Dr. Devlin.